What's up, guys? It's Celeste, and today I'm going to be answering a question that I got as a comment on my gender tag video, and it is from someone named Sophie, and Sophie wanted to know, what do you think of a cis female wanting a double mastectomy but not choosing transition to non-binary or male, but rather be genderqueer and still be alright with using female or male pronouns? Am I trans if I don't care what pronouns people use? So I wanted to answer this as a video because I think these are good questions, and they are... Squirrels are crawling on my window again. They are questions that I think are really common for people who are questioning their gender, regardless of how they end up identifying. The first thing that I want to say is that whether or not you're trans, and however you identify your gender, is something that only you can really answer. It's not something that you can ask somebody. There are things that you can ask that will help me or somebody else guide you through exploring your gender identity, but there's not really like a checklist of things that you can say, like, if I do this, this, and this, then I'm trans. Really, the only thing that you need to answer to being trans is whether or not you identify with the gender that you were assigned at birth. So the tricky part comes from trying to figure out how you identify, whether you do identify with that gender or not. For a lot of people, it's not tricky at all. It's pretty simple. They know that they identify as male or female or whatever. But for many of us, it can be a little bit trickier to kind of figure out, like, what does it mean to identify with a gender? Like, is it just about how you feel about your body? Is it about your interests or, traits and things like that? So I'm going to try to answer this and, give my own opinion or my own feelings on this stuff. But like I said, it's not something that I can just like say, oh, well, that means you're trans or whatever. It's really something that you have to kind of answer for yourself. So the first thing that I kind of want to address is where it says not choosing transition to non-binary or male, but rather be genderqueer. So genderqueer is a gender identity that falls under non-binary. So I kind of think that what this question is getting at is when they say transition to non-binary or male, they're talking about like physically transitioning to either a male-presenting body or appearance or a like completely androgynous one. So I think it's really important to mention that how you express your gender and how you appear is not necessarily, like, there's not just one way to appear male or one way to appear non-binary. There are people who present in a fairly feminine way, fairly masculine way. There are people who are assigned female at birth who continue to appear pretty much the same as they always have. It's just internally they feel like their gender identity is not female. So physical appearance and particularly medical transition is not necessary to identify as non-binary, genderqueer, or trans. Like, anybody can identify as those things if you like internally feel like your gender identity is different from the gender that you were assigned at birth. That's really all that, like, that's the only checkbox you kind of need to fill. How you go about like fitting that into your life and how you go about transitioning, whether it's social transition or medical transition or anything, that's completely up to you. There are binary trans people who never use hormones or have surgery or anything like that. And the same is true of non-binary people. There are plenty of them who just don't have any desire to change their body or anything about their appearance. And the same is true with pronouns. I identify as non-binary or genderqueer, and I use she, her pronouns, which are, of course, typically considered to be female or feminine pronouns. And I use those because it's easier for me, because that's what I've always used, and I haven't really found any other pronouns that I really feel strongly about. So yeah, it's totally okay to identify as genderqueer or non-binary or trans in any way, really, and use any kind of pronouns that you feel comfortable with, or be open to any pronouns. I mean, I definitely know people who don't at all care what pronouns people use, They're totally okay with she or he or they or really anything. It's just not something that they feel really strongly about. So to specifically answer your question, you definitely can be trans and not care what pronouns people use for you. But that doesn't necessarily mean that if you don't care what pronouns people use for you, you're trans. I mean, there could be cis people who don't really care. I can't say I really know of any offhand, but I'm sure there are some that don't really care one way or the other. As far as double mastectomy, I personally feel like anybody should be able to have any kind of surgery or any kind of physical transformation that they choose for their own body. I feel like your body is yours and you should be able to make it look like you want it to look. I definitely have heard of some cis females who say that they would like to have top surgery or whatever, and I definitely know a lot of cis females who have had or want to have breast reductions. So I really feel like that's a personal choice that anybody should be able to make for themselves. Now, whether or not that stems from having gender dysphoria about your chest or about your body, that would be kind of like the distinguishing factor. Like if you're cis, then you probably don't have gender dysphoria. I mean, gender dysphoria is a thing that people feel when their gender identity does not match the gender that they were assigned at birth. So for it to be gender dysphoria, you I think would need to be trans or non-binary or gender non-conforming in some way. But to choose to have a double mastectomy or really any kind of surgery, I feel like that's completely up to you, regardless of how you identify in the rest of your life. If you feel like you're female and you want to go through your life, as a female with people seeing you as a female and, if everything about you is female except you just don't like having breasts, then, I mean, I don't see anything wrong with that at all. So kind of circling that back around to what I said before about how you present, not necessarily like you don't have to present one particular way to be non-binary or to be trans. If you, like I said, if you feel female and you want to have top surgery, then that's awesome. If what you're asking is, can I be non-binary and only want top surgery, or can I be trans and only want top surgery, then absolutely, you absolutely can. I mean, I definitely know people who feel that way. There are a lot of people who have top surgery who don't ever go on hormones and don't really do anything else in the way of transition. So I hope that this kind of answered your question. I kind of circled around a little bit, but the main point that I kind of want to make here is that how you identify, like the words that you use to identify yourself, are individual to every person, and it's something that only you know what you feel comfortable with as far as identity labels for yourself. And the same is true for your physical presentation or your goals as far as medical transition, like whether or not you want to have any kind of medical transition. That's completely up to you, and that does not in any way determine whether or not you are trans. You are trans if you identify with a different gender than the one you were assigned at birth. That's it. Like, that's the only, like I said, like checkbox that you kind of need to fill. And I think this is like super important to talk about because when I was first like barely starting to question my gender identity, I felt like I needed permission, kind of. Like, I felt like I needed, I mean, it's not like I was aware of that, but what really helped me start to really explore my gender identity was non-binary and trans people saying that it's okay to question, that it's okay to present however you want to present, it's okay to identify, like use the words that you feel comfortable with, it's okay to use pronouns that you feel comfortable with, and it's okay to not follow this really narrow, like, narrative that we have kind of had for a while about what it means to be trans. At this point in my life, over the last couple years since I've been exploring my gender identity, I have kind of ended up, like, feeling differently about certain things than I did at the beginning. Like at the beginning, I never thought that I would have surgery. I never thought that I would want to go on hormones. I mean, up till like 4 or 5 months ago, I never thought that I would want to go on hormones. So I'm not saying that to imply that like everyone ends up like getting closer to that narrative that I was talking about. That's definitely not what I'm saying. But I'm just kind of saying that like how you feel at the beginning is, I think, largely informed by the ideas that you kind of have about that narrative and about yourself, many of which were kind of placed upon you. And it's only like once you start really like peeling that back and like parsing out the things that you really personally feel comfortable with or feel strongly about versus the things that you kind of were raised or socialized to expect to feel or be expected to feel comfortable with, and so on. Like, I guess what I'm trying to say is like, if you're questioning this, then I think it's worth exploring. Like, however far away you are from the narrative that you might be familiar with for what it means to be trans, like, I think it's worth exploring if you are questioning it even a little bit, because you just never really know until you really start looking at it and thinking about it where you're going to end up. And it might be that after you explore it, you might end up feeling like, you know what, I really am cis female. Like I still feel comfortable with that, and I guess I'm not trans or I'm not non-binary. And that's totally valid. Like there's nothing that says that you have to end up being trans to explore your gender identity. I think that kind of everybody should do that to a certain degree, because I feel like even if you end up being cis, like you might still learn things about yourself, like learn more about what makes you feel comfortable or learn more about what makes you feel like you fit into the world that you wouldn't have really thought of otherwise. So thank you so much to Sophie for writing in with that question, and I hope that I did an okay job answering you. But like the most important thing that I want anybody who's watching this to take away from this video is that how you identify and your personal transition and everything like that is something that is personal to you, and it's something that nobody else can answer for you. Nobody else should be trying to gatekeep you on, and you should absolutely follow the path that makes you feel the most comfortable with yourself. If you like this video, give it a thumbs up and subscribe to see more of my future content. Thanks so much for watching, and I'll see you guys next time.